Today I am going to discuss with you hepatitis B virus infection. Hepatitis B virus is an inflammation of the liver caused by hepatitis B virus infection of the liver, and hepatitis B virus infection can cause liver cirrhosis and can cause even progression to liver cancer. So let us know how hepatitis B virus is transmitted. Number 1, hepatitis B virus is transmitted from mother to child during birth, during delivery. An infected mother with hepatitis B virus can transmit the virus to the child or to the newborn baby. The second is because of the sexual transmission. If one of the partners is infected or having hepatitis B virus, the virus can be transmitted to the other partner. The number 3 reason for transmission of hepatitis B virus is because of the contaminated needles which are being used for injection or which are being used by the intravenous or intramuscular drug abusers when they use the contaminated needles from one infected person to the another person who may be not infected with hepatitis B virus. And it is also because of the using of the contaminated tattooing equipments or any of the piercing equipments. It can also get spread by using of the infected person's razor, infected person's needle which the infected person is using, or by the using of the infected person's toothbrush. And also the fourth reason, which is also very important one, is to the transfusion of blood, body fluids, especially during the blood transfusion. If the donor is infected with hepatitis B virus, and if the detection of hepatitis B virus is missed, or if the blood investigations related to various transmissible diseases are not done properly or adequately before the transfusion of blood, then the recipient or the patient who is receiving the blood, infected blood, will receive hepatitis B virus, and the patient will develop hepatitis B virus infection. Therefore, it is very important to get blood from recognized laboratories, to get blood tested in recognized laboratories where all forms of transmissible diseases which are available in the blood products are done, so that the blood do not contain any of the transmissible diseases, including the hepatitis B virus. Therefore, this is to be remembered while donating blood also, so that you will be careful that you do not transmit these viruses or these diseases to the innocent recipients of blood. You must also know that hepatitis B virus is transmitted through the contact of certain bodily fluids which are infected with hepatitis B virus. Person gets hepatitis B virus infection when you come into contact with the infected seminal fluid, when you come into contact with infected menstrual fluid, and also when you come into contact with the person having hepatitis B virus, and when you come into contact with the vaginal fluid. Therefore, it is good to know that hepatitis B virus can be transmitted through other bodily fluids other than blood. Now we need to know through which forms hepatitis B virus is not transmitted. Hepatitis B virus is not transmitted when you meet an infected person. Hepatitis B virus is not transmitted when you are having food together with the infected person. Hepatitis B virus is not transmitted when you shake hand, when you hug with the infected person. It is also known to us that hepatitis B virus is not transmitted to the baby during the breastfeeding. How will you know that you are infected with hepatitis B virus? Some people present to the doctor telling that, "Doctor, I am having nausea, I am having vomiting, I am not able to eat food properly, I am having body pain, feverish feeling, and I have developed yellowish coloration of my eyes and skin." This is the presentation of acute hepatitis B infection. And there is another group which do not show any symptoms. To these people we say they come under subclinical infection of hepatitis B virus. So now we need to know that what are the categories of hepatitis B virus infection. Just now, as I said, that there can be acute infection and chronic infection. And in the acute infection, we need to know that certain amount of people develop severe acute hepatitis B virus infection. They develop severe liver failure, which we also known as acute fulminant hepatitis. These people develop very sick form of liver inflammation, and there are chances that these people can die. So this is acute hepatitis B virus infection. How will you know that you have hepatitis B virus infection? As I said before, either you will present to the doctor telling that, "Doctor, I am not feeling well. I don't feel like taking food. I have body pain. I have feverish feeling. I have yellowish coloration of my eyes and skin." So the doctor may advise you for blood test, or you may come for routine checkup for many other illnesses or other medical intervention. Then the doctor will ask you to do a blood test related to hepatitis B virus infection. And the most common and easily available everywhere and in every health facility and in any of the medical store also is that hepatitis B virus surface antigen blood test. And once the hepatitis B virus surface antigen blood test shows a positive result, that means you are infected with hepatitis B virus. The first time if your blood test shows infection with hepatitis B virus, or the hepatitis B virus surface antigen kit shows a positive reaction, you need not worry so much initially. Yes, you will be concerned. Doctor will treat you symptomatically initially. Then the doctor will ask you, "Have you ever been tested positive for hepatitis B virus infection?" If you say that, "No, doctor, I had tested 1 month ago, I had tested few days ago for this hepatitis B virus surface antigen, but it was negative," or "I was told by the doctor in previous visit that you do not have hepatitis B virus infection," then it is a good news for you. Then the doctor will treat you for all the symptoms that I have mentioned and will advise you to keep yourself well hydrated, and take your food properly and take rest. And the good thing is that doctor will not directly start you with hepatitis V virus related antiviral medicine. He or she will tell you that please come back to me after 3 to 6 months for repeat testing of hepatitis V virus infection. Therefore, for the first time you are tested positive for hepatitis V virus infection, do not lose your heart. It is because once a person gets positive for hepatitis V virus infection, there are every chance that your body will fight against this hepatitis V virus and recover completely in 3 to 6 months after the infection of hepatitis B virus. Studies have shown that if say 100 people get infected with hepatitis V virus infection, among these 100 people, 85 to 90% of people are going to recover completely from hepatitis V virus infection. So therefore, once you get infected with hepatitis V virus for the first time, please make sure to follow the advice of the doctor and return back to the doctor to get tested again. Doctor will make you to do the test of hepatitis V virus surface antigen. And if your result shows that you have no more hepatitis V virus infection, then it is a very, very good news. I am going to tell you later on what you have to do after you have recovered from or you have tested negative from hepatitis V virus infection, and what you have to do so that you don't get infected again in future. I'm going to tell you in the later part of this video. So please watch this video till the end. So today again, after 3 months to 6 months, if you are visiting the doctor and doctor had asked you for testing once again for hepatitis V virus infection, and if it turns out to be positive again, that means you are having chronic hepatitis V virus infection. Or in some other case, people, they develop fatigue, they develop tiredness, they feel like not taking food, they feel that their eyes have turned yellow, their skin have turned yellow, they notice that their tummy is bulging, the size of this tummy is increasing, and they also notice that their legs are swelling. That also means that probably you have hepatitis V virus infection, or you have infection to do with your liver. So the treating or the consulting doctor will ask you to do a simple test for hepatitis B virus surface antigen test, and this hepatitis B virus surface antigen, once detected in your blood, that means you have hepatitis B virus infection. Hepatitis B virus surface antigen marker is one of the very, very early signal that you are having hepatitis V virus infection, and this marker also persists for long duration. So with your clinical presentation, hepatitis V virus surface antigen showing positivity, that means you are having chronic hepatitis V virus infection. Chronic hepatitis V virus infection is a lifelong disease, and you may develop many complications related to liver inflammation And one of the long-term consequences of hepatitis V virus infection, which is chronic liver disease, which will extend to having liver cirrhosis and may progress to cancer of the liver. The treating doctor will put you on oral medication. It is an antiviral oral medication which you have to take continuously till your doctor advises to take the oral antiviral medications. Once you are on oral antiviral medications, here also you need to follow up with your doctor, treating doctor, every 3 to 6 months regularly, so that doctor will monitor you how your medication is working on this infection, and this oral antiviral medication or the treatment related to chronic hepatitis V virus infection slows down the progression to liver cirrhosis and slows down the progression to liver cancer and prolongs your long-term survival and makes you to live the life comfortably. Now let us know how to stop the spread of hepatitis V virus. Please do not use unsterilized needle equipments, tattooing equipments or piercing equipments. Please avoid using somebody's razor, somebody's toothbrush. The next thing is that if a sexual partner is infected with hepatitis V virus, please use condom or encourage using condom during the sexual encounter. The third one is that please always get blood and blood products when you are sick and when you need. During the blood transfusion process, please ensure that the blood is received from a recognized lab where all the investigations are done on the donor's blood related to any of the transmissible diseases and especially hepatitis V virus. And the most important preventable intervention which you and I can do and even encourage others to do is to get vaccinated against hepatitis V virus infection. In India, the government gives free vaccine against hepatitis V virus, and especially when a baby is born, when there is newborn in the hospital, or when there is notice of newborn in the community, government has vaccines against hepatitis V virus infection. And this vaccine against hepatitis V virus infection is provided free of cost in India through the National Immunization Program or through the Universal Immunization Program. It is advised that the vaccine against hepatitis V virus infection is to be administered to a newborn baby within the first 24 hours of life. And please remember that this hepatitis B vaccine is 95 to 100% effective. It gives 95 to 100% protection against hepatitis V virus infection. So you may tell that, doctor, I have not taken vaccine against hepatitis V virus. What shall I do now? If you were not vaccinated within the first 1 year of life. So what you need to know? Please listen carefully. I am also going to tell you how I got protected against hepatitis V virus infection. So please continue to watch this video till the end. So if you have not yet got vaccinated against hepatitis V virus, you need to go to a doctor or you need to go to a laboratory which does test for hepatitis infection. A test is hepatitis B virus surface antigen test. Result of the test shows as negative, and if you are perfectly fine, you are not feeling any kind of sickness or illness, then you can go ahead in taking vaccine against hepatitis V virus infection. You need to see a doctor, and the doctor will prescribe you vaccine, that is injectable form of vaccine, any of the upper arms. So you need to take 3 doses of vaccines. 3 doses of vaccines. You need to take vaccine when the doctor advises you on that day, that is the first day, and you need to take the next dose of vaccine after 1 month, and the 3rd dose of vaccine after 6 months from the first dose of vaccine. So now I am going to tell you how I got protected against hepatitis V virus infection. Like many of us or many among the population, I also did not get vaccinated against hepatitis V virus during my childhood, during my infanthood. So when I went to medical school, on the first day of joining in the medical school, my blood was tested for hepatitis V virus infection, and when the test report came as negative, the doctors in my medical school on the first day advised me to take vaccine against hepatitis V virus infection, and I took 3 doses of hepatitis V virus vaccine, basically vaccine against hepatitis V virus infection, and today I am protected from hepatitis V virus infection. And many times I have tested my blood for the presence of hepatitis V virus, and I am glad that every time I am tested, I don't have hepatitis V virus infection. And if you are infected with hepatitis V virus, please remember to inform your close relatives, the person you are living with, your sexual partner, that you are infected with hepatitis V virus, because they can be at risk because they are living with you. So tell them to get tested for hepatitis V virus. If they are negative for hepatitis V virus infection, please inquire with them that whether they had vaccine against hepatitis V virus. If they are negative, if their blood report shows negative for hepatitis V virus infection, please ask them to see a doctor and get vaccinated against hepatitis V virus infection.